Allowance for outdoor visitation will be based on certain criteria, and these include the disease transmission level within the facility, availability of appropriate amounts of personal protective equipment and staffing, and that testing is occurring at the facility in accordance with the federal CMS testing requirements. There are 3 triggers that could temporarily suspend visitation at a facility. 1, if one or more cases are identified in residents or staff members, visitation must be temporarily suspended until the federal CMS protocols for testing in response to disease at the facility are completed. This could take a few days or longer depending on whether we identify more cases in addition to the 1. 2, if 3 or more cases are identified in staff members or residents within a 14-day period, visitation must be temporarily suspended and testing must occur per federal CMS guidance. Visitation may resume 14 days after the identification of the last case. 3, for a nursing home, if testing is not occurring per federal CMS requirements, visitation must be temporarily suspended. For assisted living facilities, testing must be occurring per these same CMS protocols within 30 days from when these guidelines are issued, or visitation must be temporarily suspended. Currently, there are 90 nursing homes in the state that meet the criteria of not having cases among residents or staff within the previous 14 days. Additionally, there are 31 nursing homes that have only had 1 case in the last 14 days and would hopefully soon meet this criteria as well. In order to reduce the risk of virus being unknowingly introduced into nursing homes or assisted living facilities, the maximum length of time permitted for an outdoor visit will be based on the testing status of the visitor. A visitor may be allowed to visit for up to 1 hour if they present a medical record documenting either a negative result from a viral test performed within the previous 5 days, and this would be a test from a nasal or oral swab or a saliva test, or a positive result from an antibody test performed within the past 30 days. A visitor who hasn't been tested or doesn't present a medical record documenting a negative test for the PCR test or a positive test for the antibody test may be allowed to visit for a maximum of 15 minutes. All visitors, regardless of test results, must pass a COVID-19 screening prior to their visit and must adhere to the rules in place for the visit, such as social distancing, staying at least 6 feet away from their loved one, and wearing a mask properly at all times.